A case of a 21-month old boy with lethargy, respiratory stress, and abdominal distention. Definition: a 21-month-old boy was brought by ambulance to the emergency department at this hospital because of lethargy, respiratory stress, and abdominal distension. Application in medicine. Toxic effects of acute salicylate poisoning. The organ system most important affected by salicylate poisoning is the central nervous system. Neurotoxicity due to impairment ATP formation may lead to agitation, combativeness, hallucination, lethargy, seizure, coma, cerebral edema, or death. It has been shown that levels of salicylate in central nervous system correlates best with death in animals. Any neurological effects are an indication of severe poisoning and should prompt aggressive management, as they did in this case once the diagnosis was known. Pros and cons. In terms of the pros, we can say that in Ecuador they made hemodialysis, that is an effective method of salicylate elimination. And in cons, the final diagnosis that was salicylate poisoning. Issues in Ecuador. They do toxicology consideration. The child presents with lethargy, respiratory stress, tachycardia, abdominal distension, and elevated body temperature. The presence of an elevated anion gap metabolic acidosis quickly narrows the list of potential toxic exposure. Multiple toxins that cause an elevated anion gap metabolic acidosis can be responsible for changes in mental status, respiratory distress, and tachycardia, but only salicylate poisoning is independently capable of causing hyperthermia brought the uncoupling of oxidative phosphorylation. In fact, by hyperthermia is more common in fetal than in non-fetal salicylate poisoning, making an elevated body temperature and an important indicator of severe toxicity. The final diagnosis was salicylate poisoning.